Right. Good afternoon and welcome to the budget hearing of the Public Safety and Administration Subcommittee of the Appropriations Committee. Today we have 7 agencies before our subcommittee, and we'll begin with the Workers' Compensation Commission. We will start with our budget analyst, Mr. Micah Richards, followed by the chair of the Workers' Compensation Commission, Ms. Maureen Quinn. Mr. Richards, whenever you're ready.
Good afternoon. My name is Micah Richards, and thank you to the chair, committee, and the citizens of the great state of Maryland for allowing me to present to you. I am presenting the Workers' Compensation Commission, referred to as WCC, Fiscal 27 Budget Analysis. Starting on page 1, it details how the WCC administers the workers' compensation law. The WCC only has a special fund in the Fiscal 27 budget is $26.5 million. Pages 2 and 3, Exhibit 1 shows 70% of the Fiscal 27 allowance supports personnel costs. Page 4, Exhibit 2, shows the Fiscal 27 allowance increases by $1.4 million compared to the Fiscal 26 appropriation. 99% of the increase is for personnel costs. Page 5 shows that there is no change in regular and contractual positions. However, the current level of vacant positions is 3.6 more than necessary to meet budgeted turnover. Pages 5 and 6, Exhibit 3 shows in Fiscal 25, around 84% of hearings were set within 60 days of the filing date, which is 6 percentage points below the 90% goal. WCC notes that during a portion of Fiscal 25, there were vacant commissioner positions. Due to these vacancies, fewer hearings could be held until new commissioners were in place. WCC should discuss the current status of hearing timeliness and other efforts the agency has made to improve them. Page 7, Exhibit 4 shows the total insurer assessment increased by $3.7 million in Fiscal 25 compared to Fiscal 24 due to salary increases. Page 8, DLS recommends WCC to concur with the governor's allowance. Page 9 details that due to the increased cap on penalties from Chapter 78 of 2024, as of January 2026, WCC has assessed penalties between $10,000 and $25,000. This concludes my presentation, and I'm available for any questions.
All right, thank you, Mr. Richards, for that analysis. Any questions of the subcommittee for the budget analysts? All right, at this time, we'll welcome the Workers' Compensation Commission to come up. I have wonderful Aisha Jefferson and your team, welcome, and you can begin when you're ready. Thank you.
Thank you. Good afternoon, distinguished members of the committee. First, I'd like to express my sincere appreciation for Micah Richards for his thorough presentation and diligent work on the fiscal 2027 budget analysis. Nice to see you again. My name is Asha Joseph Jefferson. I have the honor of serving as the newly appointed chair of the Workers' Compensation Commission. Prior to this appointment by the governor in January of this year, I served as a commissioner with the WCC for 3 years. Today, I'm joined with my exceptional team, Commissioner and former Senator Alan Kittleman, who's sitting in the back, my Chief Executive Officer, Teresa Cornish, sitting over here, my Chief Financial Officer, Dave Jones, my Director of Fiscal Services, Jay Moore, Chief Information Officer, Kevin Nauman, Deputy Director of Fiscal Services, Max Amoko, and our Director of Human Services, Chris Barrett. We at the WCC fully concur with the governor's allowance for our agency, and I know that the one question that came up was about not hitting the MFR of 90%. So I want the committee to understand that essentially last year when we had 2 commissioners who left in March of 2024, and then we had 2 new commissioners start in April, it took them about 6 weeks to go through what we call baby judges school, and for them to be able to fully get caught up and able to try cases on their own. And so we're in a similar situation right now. We have one commissioner in baby judges school, but it is going to end at the end of this week. And so then it will be 10 full commissioners ready to try dockets 5 days a week. Additionally, with those temporary gaps when the 2 commissioners concluded their terms, now with the onboarding and training, we do fully believe by next year we're going to hit that goal of the 90%. And I'm a workhorse, so I'm requiring everybody to do the work. So we are also actively implementing additional controls within the docketing process to ensure we meet and exceed our target for 2026. And I am mindful of today's committee's valuable time. I deeply appreciate your service and dedication. I welcome any questions that you might have for me, but otherwise I have nothing else to say, and I'll just ask if my colleagues have anything to add. No.
All right, thank you, Chair Jefferson, for that response. Any questions of the subcommittee for the chair of the Workers' Compensation Commission or her team? Seeing none? Mr. Chair.
Thank you. Just want to say hi to my friends in the Workers' Comp Commission and my friend, new Chair Jefferson, who I clerked with. And which circuit court did we clerk in?
We clerked in the Prince George's County.
Prince George's County, that's
Prince
right.
George's County.
Yeah.
Yes.
So we've got a little Prince George's here in the house.
Of course.
So just want to say congratulations to you on your new position, and hi to my friend Alan Kittleman in the back, who I used to work for when I worked for Miller, and he was a senator. So keep up the good work.
Thank you.
Thank you.
Thank you very much.
All right, thank you very much. That ends the hearing on the Workers' Compensation Commission. Next, we will begin. Start with the Executive Department, the Governor's Executive Department. We'll start with the Budget Analyst, Mr. Scott Benson, followed by the agency representative. Mr. Benson, you can begin when you're ready.
Good afternoon. My name is Scott Benson, and today I'll be presenting the operating analysis for the Executive Department, Office of the Governor. As you can see in the operating budget summary on page 1, the fiscal 2027 budget increases by $2.1 million, or 9%, to $25.1 million. You can see on page 2 that there is a proposed deficiency appropriation at $77,220 in general funds to transfer a position from the Department of General Services to serve as a senior communications strategist. As you can see in Exhibit 1 on page 3, the largest category of the fiscal 2027 allowance is for salaries and fringe benefits for 127 regular positions, comprising 85% or $21.2 million of the total allowance. The second largest category is for cost allocations, which comprise 5% of the allowance, or $1.2 million. The remaining agency spending is split between other operating expenses. You can see in Exhibit 2 on page 4, the largest increase in the budget is due to personnel-related costs, which are largely driven by $1.7 million for 9 new regular positions. Outside of personnel costs, cost allocations increased by $130,929, while contractual personnel decreases by $94,787 due to the end of a grant from the Climate Alliance that supported a position. You can see in the personnel data on page 5 that as of December 31st, 2025, the Office of the Governor had 8 vacant positions. These include 5 administrative positions and 3 executive aides. The Governor's office has reportedly filled one of these positions and intends to fill the remaining positions by the end of fiscal 2026. 7 of the new positions included in the fiscal 2027 allowance are to handle the responsibilities previously handled by the Boston Consulting Group. This group was employed to support the analysis and implementation of actions taken by the Government Modernization Initiative. These 7 new regular positions include 2 data analysts, 2 data scientists, a policy advisor, a project manager, and a director for the initiative that is being transferred from the Department of Budget and Management. The Governor's office should discuss the costs of the Boston Consulting Group contract and explain the reasons for using regular positions to serve this function. In fiscal 2026, the Governor's Grants Office began merging with the Governor's Federal Relations Office. By merging these offices, the Executive Department aims to improve operations, ensure that federal funds can be secured. Due to this merger, 2 currently filled positions are being transferred to the Federal Relations Office in fiscal 2027. This includes a special assistant and a deputy director of federal funds. Turning to key observations on page 6. In fiscal 2025, the Office of the Governor received funding from Bloomberg Philanthropies to create an innovation team consisting of 8 positions. This team acts as an in-house consultancy working on state priorities of childhood poverty and economic mobility by collaborating with partners and internal and external stakeholders to solve challenging urban issues. In fiscal 2025, the innovation team partnered with the Office of Financial Regulation within the Maryland Department of Labor to develop the team's first project, the Maryland Community Investment Venture Fund. This fund is budgeted under the Department of Labor and receives $2.5 million to provide grants to assist small business owners gain access to capital in low to moderate income communities. This project was launched in June 2025. In early fiscal 2026, the innovation team began a project analyzing various stakeholders' ability to access capital, where the team engaged over 150 different stakeholders, such as small businesses and community organizations. Work related to the Maryland Community Investment Venture Fund has also continued in fiscal 2026, with grant applications opening on December 1st, 2025. These will be awarded in calendar 2026. For the remainder of fiscal 2026, the innovation team expects to announce inaugural grant awards for partnerships between financial institutions and fintech companies of up to $50,000. Funding from Bloomberg Philanthropies decreases slightly in the fiscal 2027 allowance compared to the fiscal 2026 working appropriation, but remains at approximately $2.3 million. In fiscal 2027, the team plans to continue current projects and begin work on new projects, such as the expansion of the Maryland Community Business Compass, a website that assists childcare providers and fresh food providers by connecting them with experts. Additionally, the team plans to begin investigating potential applications of artificial intelligence to improve operations. As you can see in the recommended actions on page 8, the Department of Legislative Services recommends concurring with the governor's allowance. And that concludes my presentation. I can now take your questions.
All right, thank you, Mr. Benson. Any questions from the subcommittee for our budget analysts? Seeing none, I'd like to welcome at this time the representative from the governor's office. And as you get there, if you could introduce yourself, and you may begin. Thank you.
Good afternoon. Thank you, Mr. Chair, Mr. Vice Chair, distinguished members of the committee. My name is Lester Davis, and I have the pleasure and honor of serving as the Chief of Staff in the Office of the Governor. With me today is Mona Viana, with the Director of the Financial Administration in the Governor's Office. I want to thank this committee for your work. I want to take a second to extend our deepest gratitude and thanks and partnership with our analyst, Scott Benson. You did thorough work, and we appreciate your analysis, so thank you. It was a smooth partnership. This is a pivotal moment that we find ourselves in. It is an important moment, particularly in state leadership, and I know that for members of this General Assembly, you have been a part of some phenomenal work this session. I want to thank you for that, and some phenomenal oversight this session. I know that is not easy, and so we appreciate the members of this committee and certainly all members of the General Assembly. The Office of the Governor is committed to strengthening Maryland's economic foundation by reducing our over-reliance on the federal sector and accelerating growth. Some of those dynamics, particularly in the report around the Boston Consulting Group, we saw some proof points in some of that work to date that has saved the state money. We're hoping to accelerate that and to be able to do even more. We know that it's going to be required, particularly in this budget climate, to be able to find more innovative ways to stretch our dollar, and we're committed to doing just that. With this budget request, we're also advancing government modernization efforts by bringing key functions in-house and generating cost savings to the state, which we know is something that is very important and certainly something that members of this committee have had a laser focus on. We remain focused on delivering results for Marylanders, driving innovation, and ensuring a responsible stewardship of taxpayer dollars, which is our highest calling. Our written testimony is before you, and on behalf of the Office of the Governor, I want to thank DLS for their concurrence on the governor's budget allowance, and certainly happy to answer any questions from members of this distinguished committee.
All right, thank you, Mr. Davis, and welcome to your team to the subcommittee. Any questions for the witnesses? All right, seeing none, thank you very much. Appreciate it. That ends the budget hearing on the Office of the Governor. Next, we will move to, I want to make sure we don't have anyone. Okay, good. Next, we will move to DPSCS Division of Pretrial Detention and Services. We will begin with our budget analyst, Mr. Josh Weinstock, followed by our secretary, Ms. Carolyn Scruggs. Mr. Weinstock, whenever you're ready.
Good afternoon. My name is Josh Weinstock, and today I'll be presenting the fiscal 2027 budget analysis for the Division of Pretrial Detention and Services within DPSCS. The fiscal 27 budget totals nearly $395 million, which is an increase of $1.4 million, or a little less than 1% from the 2026 working appropriation. I'll start with the performance analysis. In Baltimore City, all arrestees are processed at Baltimore Central Booking and Intake Center, or BCBIC. In the past decade, BCBIC has seen an overall decline in activity. Exhibit 1 on page 4 shows the number of individuals processed and the rate of commitment. There were over 16,100 individuals processed in fiscal 25, an increase of nearly 5% from the year before. Commitments also increased by about 5%, and the rate of commitment, or the share of processed individuals who are required by court order to be detained until their trial, stayed relatively level at 59%. In addition to the pretrial detainees who are held in Baltimore City, DPDS holds some sentence offenders in its custody. Exhibit 2 on page 5 shows the average daily population of sentenced offenders, local pretrial detainees, and federal pretrial detainees in Baltimore City over the last decade. From fiscal 24 to 25, local detainees decreased by 6.5%, while sentenced offenders increased by nearly 13%. Similar to what we saw with corrections, assaults also increased again this year for pretrial detention. The estimated number of individual-on-individual assaults are shown on Exhibit 3 on page 6. There was a 10% increase from fiscal 24 to 25 in individual-on-individual assaults. This was driven by the Baltimore Central Booking and Intake Center, BCBIC, and the Maryland Reception Diagnostic and Classification Center, MRDCC. The facility with the highest rate of assaults is the Youth Detention Center, which only has about 115 offenders, but has an assault rate of 86 assaults per 100 offenders, which is nearly twice as high as any other facility. Over the past 5 years, there has been a 73% increase in the number of individual-on-individual assaults in pretrial facilities. Exhibit 4 on page 7 shows the estimated number of assaults on staff over the past decade. In fiscal 24 to 25, assaults on staff increased 3%, and over the past 5 years, assaults on staff increased nearly 68%. Page 8 discusses the Pretrial Release Services Program, PRSP, which interviews, investigates, and presents recommendations to Baltimore City courts concerning the pretrial release of individuals accused of crimes. Exhibit 5 shows the number of supervision cases received by PRSP, which decreased by 7% from fiscal 2024. Exhibit 5 also shows the number of pretrial investigations, which increased in fiscal 25 by 11% from fiscal 24 and has increased 37% over the last 5 years. Moving on to the budget, there are proposed deficiencies totaling nearly $18 million. The two largest deficiencies are $8.5 million for the cost to cover fiscal 2025 shortfalls in the inmate health care contract, and a net increase of $5.4 million due to a new federal contract to operate the Chesapeake Detention Facility, which will be discussed later in Issue 2. The fiscal 2027 allowance totaling nearly $395 million, 64% of which supports 1,726 regular positions and 11 contractual positions. The inmate health care contract accounts for $107 million, or 27% of the allowance. The allowance is broken out by major spending areas in Exhibit 7 on page 10. The fiscal 27 allowance increases by $1 million overall, but after accounting for the proposed deficiency appropriation for medical costs associated with the fiscal 25 shortfalls, the budget increases by approximately $10 million. The main driver of the change is personnel, mainly due to $8.6 million in increased employee and retiree health insurance and a $2 million increase in overtime costs. Partially offsetting the increase is a $4 million decrease in land improvement projects that ended in fiscal 2026. The other changes are broken out in Exhibit 8 on pages 11 and 12. On page 12, there's a discussion of the emergency closure of the Maryland Reception, Diagnostic, and Classification Center, or MRDCC, last December. In fiscal 25, there was an average of 423 pretrial and incarcerated individuals in the facility who have now been transferred. However, the fiscal 2027 allowance still includes $64 million to operate the facility. The department should comment on its long-term plans for the MRDCC facility, including its plans to resolve the facility's structural issues. DPSCS should also discuss how the other facilities are accommodating the transferred pretrial and incarcerated populations, and how the department plans to realign MRDCC's budget to other facilities. Moving on to personnel on page 13, the fiscal 27 allowance transfers a net of 28 regular positions to other DPSCS divisions, driven by a net decrease of 11 positions at Baltimore Central Booking and Intake Center. DPSCS should comment on the reasons for the reduction in positions. In December 2025, DPDS had 105 vacancies, or a vacancy rate of about 6%. However, they are budgeted for a nearly 13% vacancy rate. In other words, they have 114 vacancies, fewer than necessary to meet the budgeted turnover in fiscal 27. This difference has the potential to produce a shortfall in fiscal 27. However, funding could be transferred from other DPSCS divisions. The first issue in today's analysis is about compliance with the Duval versus Moore consent decree. In 2015, the ACLU filed on behalf of Jerome Duval and other detainees to reopen a partial settlement agreement regarding conditions at the former Baltimore City Detention Center, which is now BCBIC, and the Metropolitan Transition Center, or MTC. The state agreed to overhaul the jail's healthcare system and make major improvements to the facilities, including accommodations for those with disabilities. The consent decree has been extended 4 times since 2020 and is now set to expire in June 2026. Appendix 2 on page 21 lists all the compliance provisions outlined in the Duval-Moore decree. In September 2018, a court-assigned monitor declared DPDS had reached substantial compliance in all areas of the physical plant requirements. And as of December 2025, DPDS and the plaintiffs agreed to terminate the mental health provisions of the decree after the department was deemed in compliance. Exhibit 10 on page 16 shows the remaining medical provisions of the consent decree. As of December 2025, DPDS was in substantial compliance with 5 of those provisions, partial compliance with 22 provisions, and non-compliant with 6 provisions. Among the active medical provisions that are remaining, there has been little improvement. From October 2023 to December 2025, only 1 provision improved from non-compliance to partial compliance, and no provisions have moved from partial compliance to substantial compliance. DPSCS should discuss the steps taken to achieve greater compliance with the medical provisions of Duval versus Moore and its plan to achieve compliance by June 2026. DLS determined the report the department submitted on the Duval versus Moore consent decree to be in compliance with the budget language and recommends the release of $100,000 in general funds. DLS will process a letter to this effect if no objections are raised by the committee during the hearings. DLS also recommends adding language that restricts $100,000 in general funds pending a report on DPSES's strategy to reach full compliance with Duval versus Moore by June 2026. The recommendation appears on page 19. The second issue in this analysis discusses DPSES's new contract with the U.S. Marshal Service for the Chesapeake Detention Facility, or CDF. CDF is a maximum security facility for federal pretrial detainees that DPSES has operated on behalf of the U.S. Marshal Service. The previous contract ran from September 2010 to August 2025, and was adjusted every 2 years based on inflation. It also included a lump sum of $2 million to support the construction of the Dorsey Run Correctional Facility. Exhibit 11 on page 17 shows the amount of federal funds and general funds needed to operate CDF since fiscal 2021. The prior contract was not based on the actual costs paid by the state, which led to substantial general funds being used to operate the facility, especially in fiscal 2024 and 2025. DPSES agreed to a 7-year contract from November 2025 to October 2032, requiring the department to provide 384 beds for federal detainees. From fiscal 2028 to 32, the contract increases each year by an average of 4.4%. However, from fiscal 2016 to 2025, the actual cost to operate the facility increased by an average of about 8% a year. The department should discuss the contract with the U.S. Marshal Service, including a justification for why the contract was renewed. Additionally, DPSES should discuss how the new contract reduces the need for general funds and strategies the department is using to reduce general fund need. That concludes my presentation. Thank you.
All right, thank you, Mr. Weinstock. Appreciate that. I see we have a question from Delegate Kaiser. Delegate Kaiser.
Thank you, Mr. Chair. So good to see you. Mr. Weinstock, thank you for that analysis. I was curious on page 16 to make sure of our report, if I understand the nuance of what's being suggested here. In one case, we're recommending the release of $100,000 in general funds because of the compliance, but then holding back $100,000 to reach full compliance. So I just want to make sure you explain that a little further.
Yes, thank you for that question. The release of the funds refers to a report they submitted last year. The funds that we would restrict would be for a report that would be due later on this upcoming year.
Well, what's the difference in the reports?
It would just be an update on the status of them reaching compliance with the consent decree.
Thank you.
All right. Thank you, Delegate Kaiser and Mr. Weinstock. Any other questions for our budget analysts? Seeing none at this time, I'll welcome Secretary Carolyn Scruggs, no stranger to this subcommittee, and her team. And you can begin whenever you're ready, Madam Secretary.
Thank you. Good afternoon, Delegate Acevera, Chair, and members of the committee. For the record, my name is Carolyn J. Scruggs. I'm Secretary of the Maryland Department of Public Safety and Correctional Services. With me today are Toyin Bakari, our Acting Deputy Secretary of Administration, and Kimberly Bay, our Commissioner for the Division of Pretrial Detention and Services. The department always appreciates the collaboration with Mr. Weinstock's hard work and analysis, and I also want to recognize and thank our DBM analyst that's in the audience, Ms. Christina Jorge Tuyon, for her advice and guidance through this process. In the analysis, DLS asked us to respond to 4 issues and 1 recommended action. You do have my written testimony, I hope, and where we have addressed each one of those issues, but I would like to take a moment to clarify a few things. The first thing that I do want to clarify was the assault information that was just presented to you. YDC, which is the Youth Detention Center, did not have the highest rate of assaults. From February 2025 to March 2026, March 4th of this year, they have had a 4% assault rate, and that is compared to BC BIC, Baltimore Central Booking and Intake Center, where theirs was 11%. So in pretrial, BC BIC actually had the higher assault rate for that entire year. I would also like to take a moment to expand on the Duval versus Moore. I am happy to report that we are in compliance for the mental health aspect of Duval versus Moore. I will say it again to you. We are in compliance. After over 50 years, the court on December 10th granted us compliance and free from the mental health portion of Duval versus Moore. And that is tremendous for my team. We are very proud of the success that we have made with that. We are continuing to work forward and strive to do the same thing with medical. This is, it's major, not just for us, but for the state of Maryland and this achievement, because if you are not familiar with Duval versus Moore, it started in 1976. So since 1976, we have been working towards this compliance. The department has also made significant changes to the scope and the scale of the provision of the medical and mental health care provided to incarcerated individuals at BC BIC and MTC Infirmary. This includes new medical and mental health care services contract that substantially increases the required professional staff available within our facilities. The Division of Pretrial Detention and Services has correctional officers now who are trained medical liaisons within the facilities, and they assist with the coordination and care and transport if they need to go outside the facility for special clinics and other medical needs. The department has also made upgrades to its electronic patient record system to support quality documentation and care delivery. These upgrades have improved interoperability between systems that maintain healthcare records, medication, and custody records. Regarding medical compliance, we continue to work with the medical monitor to document, report, and demonstrate ongoing substantial compliance with the settlement agreement's medical care provisions. And these provisions that we're still working on are intake screening, urgent referrals, continuation of medication, the medical plan, the plan of care, just to say a few. But what I will also share with you is while we continue to work on that with the monitor, our attorneys that have reviewed all of our documentations have advised us that we are in compliance at this point. So we are now waiting for the review from Dr. Kumar and his team on those aspects. So the department continuously evaluates our services to ensure the delivery of high quality medical care to this population, and we still have more progress to make. As always, we want to achieve higher rates of progress and do much better. Lastly, I just want to acknowledge the men and women of the department that have gone above and beyond to help with the transition for MRDCC. Depopulating MRDCC was in conjunction with a review from the Office of the Attorney General. This dedicated staff worked hard and immediately and safely depopulated 393 incarcerated individuals who were transferred to facilities within the available capacity. Moving forward, we will evaluate whether to repair or permanently decommission MRDCC based on safety, costs, and the system-wide needs of our facilities. DPSCS is working along with DGS, and we are proactively reviewing all of the other state correctional facilities to identify existing deficiencies and implement short-term and long-term viable solutions. And that ends my testimony, and I'm happy to answer any questions for you.
All right, thank you, Madam Secretary. Any questions of the subcommittee for Secretary Scruggs, Vice Chair Ivey?
Thank you, Mr. Chair, and thank you, Madam Secretary, for being here. Really appreciate it. So you were mentioning earlier, and we're very excited to hear the compliance on the mental health portion of Duval. For myself and everyone else watching who may not be as thoroughly knowledgeable as you are, could you walk us through what that means for us moving forward? You said mental health portion.
Absolutely. So when this journey was started in 1976, it was started because of the then BCDC, Baltimore City Detention Center. And it was based on the conditions of confinement for the incarcerated individual there. One of the conditions of confinement was the lack of proper medical and mental health care. So the department has been fighting this journey since 1976. In order for us to be in substantial compliance, we had to be for 2 6-month periods in considerable substantial compliance. So they had to come back and they had to repeat it again. And on December 10th, we went back before Judge Maddox, his team, and in agreement with both the monitor as well as ACLU, we are now in compliant for mental health. So that has been a checkbox taken off of that decree, and we're working hard to do the same for medical within the next months or so.
Yeah.
I just wanted to state on the record, you know, the chair and I were born much after 1975, so thank you.
All right, thank you, Vice Chair Ivey, for oversharing. Next, so seeing no further questions from the subcommittee, that would end the budget hearing on the DPSCS Division of Pretrial Detention and Services. I want to thank you, Madam Secretary, and your team just for being here and providing those responses, and certainly looking forward to working with you. It is a huge agency that you're responsible for, that it accounts for a lion's share of the work that we do here in PSA, and so we look forward to working with you on just, you know, some of these outstanding issues, right? So I appreciate it. Thank you so much. And next we will have the Department of Juvenile Services, DJS. We will begin with our budget analyst, Ms. Madeline Miller, followed by our I don't know if acting secretary or secretary. There we go. Betsy Fox Tolentino and her team. Whenever you're ready. Thank you.
Good afternoon, Chair and Committee. My name is Madeline Miller, and today I'm presenting the operating budget analysis of the Department of Juvenile Services. The allowance increases by $1.9 million to $381.8 million. The fiscal 26 appropriation grows by a net of $15.9 million in general funds for proposed deficiencies. These deficiencies add $8.6 million for legal fees and data archival needs associated with the Child Victims Act, $6.1 million of which is not continued in the allowance. Also added is $4.2 million for medical care contracts and $3.8 million to fund shortfalls from fiscal 2025. The Managing for Results section begins on page 4 with the discussion of certain crime prevention activities that DJS engages in, such as through credible messenger programs, including the Thrive Academy. In fiscal 2025, 157 youths received services through the Thrive Academy, a 45.4% increase compared to fiscal 24, which was the first year of the program. DJS reports that it plans to publish a data dashboard with information about the Thrive Academy to its website later in calendar 2026. DJS also provides credible messenger programming through its enhanced services continuum, through the accountability, confidence, communication, economic self-sufficiency, skills training, and success program, or ACCESS. ACCESS was previously referred to as the Detention Diversion Advocacy Program. The department reports that it will create data dashboards to show youth outcomes for community-based programming in calendar 2026. It is also conducting an equity analysis of its service continuum and expects to conclude this analysis in April of this year. The second piece of MFR analysis begins on page 5, where Exhibit 1 shows juvenile arrest trends from the past 5 years. Arrests and referrals from law enforcement are the most common ways that DJS becomes involved with the youth. Total juvenile arrests over the referenced 5 years increased by 20.1%, but are 60.1% higher than the pandemic era low in calendar 2021. Complaints, which are written statements that allege a youth has committed one or more delinquent acts or is a runaway truant or ungovernable, and may be subject to juvenile court dispositions, can be made to DJS by law enforcement, schools, parents, and members of the community. Exhibit 2 on page 6 shows the number of complaints made to DJS in fiscal 23 through 25, categorized by most serious alleged offense within the complaint. Of the 13,274 complaints in fiscal 25, about 62% are related to alleged misdemeanors. After receiving a complaint, a DJS intake officer must make an intake decision guided by its intake decision tool. The officer may also use the Detention Risk Assessment Instrument, or DRAI, D-R-A-I, to make an emergency detention until the next court day if requested by law enforcement. The DRAI tool is revalidated every 5 years, and the most recent validation went into effect in February 2026. Exhibit 3 on page 7 displays the total number of complaints received by the department over the past decade and the share of possible decision outcomes made in each fiscal year. There were 6.4% fewer complaints received in fiscal 25 than in 24. The share of formal cases or those that require court intervention increased by 3.5% between those years, but that number was still 14.9% below the pre-pandemic level in fiscal 2019 data. Fiscal 2026 year-to-date data suggests that there could be a 23.9% decrease in cases closed at intake compared to fiscal 25, but that formal cases could increase by 19.2% and informal cases could increase by 21.9%. Informal supervision is one of the 3 types of non-residential populations associated with the department and begins the next MFR section, the bottom of page 8. The other 2 are youth on probation or in youth and aftercare programming following a discharge from a residential facility. An exhibit that shows the non-residential population trends is shown on page 9. Between fiscal 22 and 25, the average daily population for the non-residential caseloads rose by 14.8% to an ADP of approximately 1,742 youth. Probation cases accounted for 63.7% of caseloads, aftercare cases for 17.4%, and informal cases for 18.9%. The average daily population for the non-residential caseload is estimated to increase by 19.6% between fiscal 25 and 26. DJS limits the number of youths committed to its facilities by diverting youth to more therapeutic placements when possible, such as an alternative to detention program, or ATD. ATDs include community detention with or without electronic monitoring, evening reporting centers, and shelter care. Exhibit 5 on page 11 shows average daily population for each type of ATD program category in fiscal 25. Electronic monitoring is the most frequently used program, accounting for about 60% of cases in that year. A discussion of data related to DJS residential populations appears on pages 11 through 16. The detained average daily population consists of 3 subpopulations: the secured detention predisposition, secured pending placement population, and the adult court authorized detention population. As shown in Exhibit 6 on page 12, since fiscal 21, the detained ADP rose to about 264 youths in fiscal 24. The fiscal 24 level remained about 6% lower than the pre-pandemic fiscal 2019 level. And then between fiscal 24 and 25, the detained population was nearly level. Draft data published by DJS for the first 6 months of the current fiscal year suggests that ADP of detained youth could decrease. Based on fiscal 26 year-to-date data, the adult court population now accounts for about 46.6% of the detained population, which is the lowest proportion since fiscal 2020 when it was 42.2%. As shown in Exhibit 7 on page 13, the average length of stay for those 3 populations has increased by 10.1% for predisposition youth, 61.9% for pending placement youth, and 15.2% for the adult court authorized youth compared with the fiscal 2019 levels. All three populations are expected to grow in fiscal '26, even as the average daily population is expected to decline. Post-court decision, some youth receive committed treatment in a residential setting, such as in a state-run facility, or DJS may also contract for such treatment to be provided in-state or out-of-state. Exhibit 8 on page 15 shows the committed residential average daily population for each of the possible committed placement types between fiscal 2016 and estimated 2026 data. Between fiscal 25 and 24 and 25, the committed residential average daily population rose by about 1.6%. Committed residential ADP is expected to be similar or to decline in the current year. Most of the decline would be from the average daily population of state-operated facilities. Since fiscal 2016, the contracted in-state population, or per diem placement youth, that average daily population has fallen by over 82%, to 65 in estimated fiscal 2026 figures. The out-of-state average daily population decreased by 3.6% from just over 8 to 8 youths between fiscal 24 and 25. Reentry and recidivism measures are discussed on pages 16 and 17 with exhibits 9 and 10. DJS case managers complete pre-discharge checklists and post-discharge checklists 30 days after youth's release to determine if the youth is appropriately connected to needed services, has successfully re-enrolled in school, and remains in stable and suitable housing. Those outcomes from those visits are summarized and published through the MFR data. Compared with fiscal 2024, fewer youth were enrolled in workforce development programs. More youth had their families attend the planning meetings, and slightly fewer youth in DJS facilities had completed program units in education, work readiness, life skills, wellness, specific trade, or on-the-job training. Through the fiscal 2025 data resource guide, DJS reports that for its fiscal 2023 cohorts, 83% of youth for probation dispositions and 81.5% of youth released from committed treatment were successful and not reconvicted of a new offense within 12 months. Exhibit 10 provides the 2- and 3-year recidivism rates for those youth populations. Within 2 years, 72.4% of released probation and committed youth from the fiscal 2023 cohort were not reconvicted of a new offense. A discussion of the fiscal 25 and 26 budgets appears on pages 18 and 19. At fiscal 2025 closeout, DJS reported unprovided for expenses to the Comptroller's Office of approximately $3 million and stated that that fiscal 26 deficiencies were needed to pay for services such as $1.3 million for purchase of care and legal services contracts and $1.5 million for somatic health and nursing services. Ultimately, about $3.8 million is added to fiscal 26 to cover 2025 shortfalls, as described in the proposed deficiency section, including vehicle replacement and programmable logic controller costs. Overall, 14 deficiencies at a net of $15.9 million. Other areas of increase include legal fees and data archival contractual services, medical care contracts, and temporary air conditioning at the Baltimore City Juvenile Justice Center. Growth is offset by the removal of IT equipment funding costs, per diem contractual services, and some of the funding associated with opening a youth drug treatment center that I'll discuss more in a moment. Now moving to fiscal 27, Exhibit 11 on page 20 provides an overview of agency spending. Approximately 72% of the budget supports personnel costs, and 12% is used for youth programming. The proposed budget change chart is on pages 21 and 22. Costs for personnel increased by a net of $18.8 million, including for 8 new positions at that noise facility. The largest decrease in spending shown on page 22 is associated with Chapter 5 of 2023, the Child Victims Act, while fiscal 26 deficiencies add $8.6 million for legal fees and data archival services from the Maryland State Archives. The amount provided in fiscal 27 is estimated to be $2.5 million, and that's just for the legal services costs. No data archival costs are estimated to be needed in the allowance. A discussion of the BRFA and 2 sections that are relevant to DJS begins on page 22. Section 10 of the BRFA this year would amend language that was added to the fiscal 26 operating budget bill. That language specified that $3 million in general funds be used to reopen one of the department's temporarily closed facilities as an adolescent drug treatment center that DJS could use as a treatment alternative to detention or commitment. And the site selected was the Alfred D. Noyes Children's Center in Montgomery County. Because the facility was a hardware secure when it was open, DJS has been dehardening the facility in fiscal 26, removing certain detention grade features. While closed, the facility had also been used for storage. Section 10 of the BRFA proposes altering the language to instead allow the funds to be used for providing drug treatment services at other youth-serving facilities and to reopen Noyes as a facility for children, not specifically for DJS children. The Noyes property is located immediately next to a Regional Institute for Children and Adolescents, or RICA facility. In coordination with the Maryland Department of Health and the Department of Human Services, DJS plans to relocate Noyes, the facility for children, or FFC, that is currently located at the RICA facility. FFC operates for youth who have been court-ordered to seek treatment. DJS would then open a substance use program at the RICA facility. This would allow the current FFC to expand from a capacity of 8 youths to 16. DJS also plans to provide educational services on the Noyes campus with JSEP, or Juvenile Services Education Program, staff. The allowance includes approximately $3 million for these purposes, including $915,000 for new JSEP positions and $1.5 million for DJS to procure services for operating an 8-bed substance abuse program. An opening date for Noyes, or a date that the facility swap would occur, is not yet certain, though it's estimated to be in calendar 26. Other details have also not yet been finalized. The Department of Legislative Services recommends that $250,000 in general funds be withheld pending the receipt of a report on the operation of both facilities, the ongoing relationship between DJS and MDH, and the spending plans for fiscal 26 and 27, and that report would be due during fiscal 27. No change in the DJS budget is associated with Section 12 of the BRFA, which relates to providers with rates set by the Interagency Rates Committee, but some DJS providers would be impacted. Returning to the proposed budget change, spending on non-residential spending on non-residential per diems contracts decreases by approximately $5.4 million between the 2 fiscal years. These contracts support costs for intensive in-home family therapy and supports. Exhibit 13 on page 24 shows that the allowance is level funded with fiscal 25 actual costs. As discussed previously, the department's non-residential caseload is estimated to increase between fiscal 25 and 26, and in its testimony, DJS should comment on the variations in budgeted levels between fiscal 25 and 27 and the reasonableness of the allowance given recent trends in the caseload. Another area with decrease between fiscal years is spending on the enhanced services continuum, as shown in Exhibit 14 on page 25. Spending falls by $1.25 million. The Department of Budget and Management reports that the reduction in fiscal 27 is due to startup delays in providing the programming expansion funded in last year's budget. In its testimony, DJS should comment on the funding decrease. The allowance also grows by $250,000 in connection to work planned to restore a cemetery or burial ground in Cheltenham, Maryland. One of the current detention centers, the Cheltenham Youth Detention Center, is a successor facility to one known as the House of Reformation and Instruction for Colored Children, or HRICC. Several detention facilities have been operated at the Cheltenham campus since 1870. In July of 2025, recognition of a burial ground for boys who died at HRICC was publicly announced, and general obligation bond funding was awarded to the department in January of this year for DJS to procure ground-penetrating radar services to identify unmarked burials through a hired contractor, reset and repair extant grave markers, install fencing, and erect commemorative signage, and then in collaboration with the Department of Veterans and Military Families, develop a cemetery conservation plan. A specific spending plan for the general funds has not yet been determined. Personnel data is shown on pages 26 through 29. In fiscal 26, 11 positions were abolished due to the voluntary separation program. The allowance grows by 8 regular positions for education staff at Noyes. And at the end of calendar 25, there were 247 vacancies, or about 11.6% of all positions. Many of the DJS personnel work directly with children in facilities or in the community. High vacancies, particularly among facility direct care employees, typically results in increased overtime expenses and can cause further issues for the department. Exhibit 15 and 16 on pages 27 and 28 show filled and vacant positions as well as monthly vacancy rates for community and facility direct care staff between July of 2023 and December of 2025. Vacancy rates for residential direct care staff have risen from a monthly average of 6.2% in fiscal 24 to a monthly average of 10.2% in year-to-date data. This is in part due to the department realigning vacant positions from its other functions to this position type. Vacancy data for community direct care staff has fallen since fiscal 24, when the monthly average was 10.1%. In year-to-date data, it's now 8.2%. Overtime expenditures are impacted by vacancies as well as increases in regular earnings. Though vacancy rates are higher, DJS reports lower overtime usage among its facility staff in fiscal 26. There were approximately 326,000 hours of overtime used in fiscal 26 for facility employees. In the first 13 pay periods of fiscal 26, there are approximately 137 hours of overtime used. If annualizing that rate, there would be a 16% decline compared with fiscal 25. In fiscal 25, DJS spent $19.7 million on overtime. Reducing that dollar figure by 16% estimates that fiscal 26 overtime expenditure need would be $16.6 million. The working appropriation includes $16.1 million. Additional reductions in overtime usage or additional funding to be spent on overtime may be necessary, as the allowance only includes $13.5 million. DJS had comment on its recent efforts to reduce its vacancies, particularly among facility staff, following a spike in vacancies in fiscal 25, as well as its anticipated overtime usage. The issues section begins on page 30. In response to JCR language added last session, DJS submitted a report in September 2025 on several topics. While funds were released, DLS recommended that the committees request a letter from the department by February 1 of this year to fully address the requirements and follow up on some actions that were in progress. Specifically, DJS was asked to provide an update on whether the department would be making changes to the decision grid for the tension risk assessment instrument. Also to provide a progress update on the evaluation model for some of its providers, as well as to provide key findings of a review being done of placements to programs and youth outcomes. This letter was submitted, and in the letter, DJS reported that the DRAI decision-making grid would be updated later in the month, which it was, and went live on February 18th. Compared with the previous version, DJS staff no longer has the ability to override the DRA to a less restrictive outcome for complaints involving Category 1, Category 2, or handgun violation offenses. The evaluation model and key findings from the systematic review of youth placements and outcomes are ongoing. The second issue relates to a fiscal audit of DJS that was published by the Office of Legislative Audits in May of 2025. Of the 9 findings, 2 were repeated from a prior audit. The findings were for the period of April 2020 to December of 2023. This issue provides update on findings that DJS estimated would be complete between June 30th, 2025 and January 31st of this year as part of its corrective action plan. The audit's second finding was that the department did not ensure criminal background checks were properly completed for contractors providing youth care services. As of January, DJS reports that it's on track with this action and no contract modifications are necessary to ensure compliance. A memorandum explaining the new process for the reporting of criminal background checks will be issued to currently contracted vendors. DJS should comment on the anticipated timeline or date by which that memorandum will be issued. DJS further reports that it's completely implemented the corrective actions for the finding that it could not document critical components of certain procurements and did not publish 6 awards, and that was completed as of November 17th. The audit's 8th finding was that DJS did not approve employees working double shifts on 4 or more consecutive days in accordance with its overtime policy, and did not analyze activity to identify and evaluate the consistently high levels of overtime. In its response to OLA, DJS reported that it would review its overtime policy, update it, and distribute it to staff by the end of calendar 2025. As of January, the policy is still in development and has not yet been shared with staff. The audit's 9th finding was one of the repeated ones, and was that DJS did not have adequate procedures and controls over its materials and supplies. DJS reports inventory management is now assisted by a system called High Tech. This had an approximate cost to implement of $100,000 between the fiscal 25 and 26 budgets. Inventorying of nutrition services is still in progress, but is expected to be complete by the end of the fiscal year. The one recommended action, updates, and appendices can be found on pages 33 through 41. That concludes my analysis, and I'd be happy to take any questions at this time.
Thank you to our DLS budget analyst, Madeline Miller. Any questions of the subcommittee for our DLS analyst? Seeing none at this time, I'll welcome Secretary Betsy Fox-Tolentino, Secretary of Department of Juvenile Services. If you have anyone or you're just yourself, either way, there we go. Yes, wonderful, for questions. Okay. I meant to ask that. I do have a Michael de Batista. Wonderful. Madam Secretary, welcome. Glad you were able to shed the acting part of your title. Very excited to work with you, and you can begin your testimony whenever you're ready.
Great. Thank you, Mr. Chair, Vice Chair, members of the committee. I'm Betsy Fox-Tolentino, Secretary at the Department of Juvenile Services, and I'm joined with our Chief Financial Officer, Mike DeBattista, who is via the Zoom link. I first like to thank Madeline Miller for her thoughtful and thorough analysis and for her continued partnership and engagement with the department. And first, let me begin by recognizing the staff at the Department of Juvenile Services. Our staff are the backbone of this agency. Every day they show up for our young people during some of the most difficult moments in their lives. They hold youth accountable, support behavior change, and ensure safety and celebrate progress. The progress we're making across this agency is a direct result of their commitment and professionalism. Over the past 7 months, DJS has focused on building a strong foundation of accountability, transparency, and support for staff, youth, stakeholders, and the public. And in doing so, we have prioritized strengthening our system partnerships. I've been meeting with law enforcement, state's attorneys, public defenders, and the judiciary across the state, almost in every single jurisdiction, to hear directly from our stakeholders on how DJS is performing and where improvements are needed. They are helping align expectations around public safety, accountability, and youth outcomes, and I remain committed to being responsive, collaborative, and transparent in our decision-making. DJS continues to prioritize our community-based programming as the cornerstone of our public safety initiative. We are expanding Thrive to additional providers and counties to better serve youth at the highest risk of being a perpetrator or victim of gun violence. Thrive combines intensive case management, credible messenger life coaches, and individualized supports to disrupt cycles of violence and create pathways to success. At the same time, we are strengthening the broader continuum of services so youth and families can access the right interventions earlier. Sustainable public safety requires strong community-based partnerships and meaningful opportunities for our young people. Our public safety efforts remain central to our mission. One of my first directives was to ensure that when a young person was arrested on electronic monitoring, that they would be detained until the next court date for the judge to review their status. And in February, as Ms. Miller noted, we updated our D-Ray decision-making grid to ensure that our detention decisions are better aligned with risk levels. These updates strengthen the confidence in our decision-making while still allowing DJS intake workers to consider youth's individualized circumstances. Within our residential programs, we are strengthening operations to improve safety, stability, and treatment effectiveness. Reducing our overtime has been a major priority. Through focused management strategies, facility direct care overtime has decreased by about 14% year to date. This improves our staff wellness, increases consistency for youth, and supports safer facility operations. We are also committed to ensuring that our frontline staff have the tools that they need to more effectively work with youth. All staff at the Western Maryland Children's Center have now been trained in Roca Rewire CBT, cognitive behavioral theory, giving our staff practical tools that they can use to immediately address behaviors and support behavior change. We will expand this training to all residential programs and building upon our already made investment into training our community-based staff, we will get closer to making Maryland the first state in the country where every single juvenile staff member has been trained in a version of CBT. This creates a shared framework for behavior change across the entire system. We are data-driven and committed to transparency. In January, we launched our first public dashboard, so stakeholders and the public can get online and see how we are performing and data related to their locality. We intend on increasing this dashboard to have more metrics and more real-time outcomes that we can share with our public. We're making program improvements also into our reentry. We're giving outcomes. We're looking at strengthening our outcomes for youth leaving our facilities. The residential treatment program is being redesigned, so completion is based on demonstrated behavior change rather than just time served. We are expanding our workforce development partnerships to connect youth to meaningful employment opportunities, and we are strengthening our continuity of services so when youth return home, they are supported. And we are expanding training, coaching, and supervision supports for frontline staff to improve the consistency, safety, and quality of care. So let me first jump in to where we were asked to comment on a number of actions in the analysis. First, we do agree with the recommended action for DJS to complete a report on the partnership between the Maryland Department of Health and DJS as it relates to the use of the facility noise. However, we do ask that you do not withhold any funds. We will submit that report. Next, we were asked to comment on the variations in budgeted levels between fiscal 25 and 27 and the reasonableness of the fiscal 27 allowance for our community-based services. The fiscal year 27 budget for community-based services to youth was prepared based on our most recent expenditures in combination with estimated timing for additional contracted services being brought online. The programs utilized are based on treatment needs for each youth. As such, expenditures will fluctuate as the population demographics and treatment needs change. DJS believes that the total funding across the continuum of services represents the anticipated needs for community-based programs in 2027. We are also asked to comment on our recent efforts to reduce vacancies, particularly among facility staff, following a spike in vacancies in the fall of 2025 and its anticipated overtime usage. Vacancies remain a challenge, but each position is essential to maintaining the safe and secure operation. The recent increases in vacancies is largely attributed to DJS identifying vacant positions and reclassifying them to residential advisor positions to serve in our facilities. When I started 7 months ago, I went to our facilities and I noticed an extreme shortage of staff in our facilities. Upon deeper dive into that, I have found that over the past 2.5 years, nearly 50 positions were moved out of our residential facilities while placements increased. So we did a deep dive across the entire agency spectrum to find vacancies, to be able to find positions that we could reclassify, to return those positions to the residential setting. And that's why you saw that big spike in vacancies in the residential setting. We also, though, continue to make sure that we are getting people in the door and that we are reducing our vacancies. And we're going to use the same strategies that we applied to driving down our overtime utilization to increasing our hiring. We are gathering every week as an executive team, looking at strategies and developing initiatives to bring people in the door. And we will meet every week until we start seeing those numbers go the way we want them to. And we're also streamlining screening and developing a centralized one-stop hiring model and in coordination and learning from our other agencies, specifically the Department of Public Safety and the Department of Human Services. We are also asked to comment on the anticipated timeline or date by which a memo will be issued to our contracted vendors to ensure that there's compliance with background checks. We are reviewing and updating our policy now. We anticipate that we will have updated policies and guidance to all our contracted vendors by June of 2026. I think I got all the places you asked me to comment. I thank you for your time, and I'm happy to answer any questions.
Thank you, Madam Secretary, for that very thorough response. It is certainly appreciated. Are there any questions of the subcommittee for our Secretary of DJS? I'm looking at the usual suspects. But with that, so yeah, there we go. Vice Chair Ivey.
Thank you, Mr. Chair. I felt compelled. First of all, congratulations on your appointment. Really, I just wanted to thank you for your transparency, your team over the years. They've been great, and I appreciate seeing familiar faces with you as well. So however we can help move your mission forward, please, we're partners here. I love looking at the update on the Thrive program that you all are running. And so I'm watching closely, and I appreciate the work that you do. Thank you, Mr. Chair.
Thank you, Vice Chair.
All right, thank you, Vice Chair Ivey. Madam Secretary, just a couple of questions before you head out, but the first is, and I feel like you've touched on it in your testimony, but Maryland's an outlier in terms of the incarceration of youth, juveniles, particularly in adult facilities, and we have legislation that we're considering to address that. And just curious as to what, if there's a particular focus on recidivism to ensure, those who are under the care and the custody of DJS, that, once they have, served their time, they're able to then, have the support that they need to lead productive lives and aren't necessarily going to be back a few months later. Any particular focus on recidivism amongst juvenile offenders?
Yes, we're looking at recidivism sort of from two different approaches. One is the young people who are committed to our care for long-term residential treatment. When I came back to the department, one of the first things I also noticed was the young people that we have in long-term residential treatment, they're older. So they need different supports when they're going home. 4 or 5 years ago, the average age was probably 15 in our facilities. Today, it's more like 18, 19. And so we want to make sure that our young people, when they leave, are not just equipped to be able to go home to their home communities, but they are on a pathway to independence, that they are getting the necessary supports to be able to connect into workforce opportunities. And we have a new superintendent in our juvenile services education program who shares those values and is already bringing in a new focus to increase access to high school diploma attainment, increase access to workforce development programs. The other way we're looking at also reentry and recidivism is a large portion of our young people are detained. A large portion of those young people don't actually get to a disposition in their case. Their cases are dismissed or disposed of before they would be placed on, say, probation or go to long-term treatment. Those young people then reenter our community after a period of incarceration. And because they're not on probation or committed, we don't really have supervision over them, but the department can and will do more to support them as they return to their home communities. Any time of incarceration we know disrupts core interventions in the home and their core connections to, say, school or work or even their families. We want to make sure that they have the right supports to build on those connections. So if they're leaving from a juvenile education services program or school program, we want to make sure that we are intentionally helping them get back into school. We want to make sure that we're connecting them to community-based programs that can hopefully disrupt any future reoffending and having them come back to us. And I will note that, yes, Maryland is an outlier, and the number of youth who are detained in adult facilities. DJS has been supportive of the legislative initiatives to reduce the number of charges that result in auto-charging youth into the adult system. And we believe making those legislative changes will reduce the reliance on adult detention facilities for youth who are charged as adults.
Appreciate that, Madam Secretary, and that's good to know. Last question, just tapping into your experience, you shared, you used to be a public defender and you represented youth, juveniles. There isn't a procedural difference between the interrogation of an adult and the interrogation of a minor, is that correct?
There is, and I will tell you, this is probably not my strength and focus, because we don't enter in as the department in that moment, but there is a difference.
There is a difference, okay. And law enforcement during an interrogation, particularly of a minor, can still lie to minors, can they not?
I can't really comment on that, Mr. Chair. I'm sorry. I don't have all the information. As I wasn't a public defender when that changed, I was at the department. So we can definitely circle back and I can dig in more.
Yeah, sure thing. So we certainly passed a good bit with SEPA, the Child Interrogation Protection Act. But even with that, I mean, there is still the possibility that law enforcement can lie to youth, to minors during interrogation. And so just curious because, when we talk about, juvenile offenders, et cetera, particularly those that are charged, I mean, these are interrogations that are happening, and what, if any, experiences there are with those juvenile offenders who, cases are now being adjudicated but were lied to. But we can certainly talk some more offline. I appreciate your responses. Any other questions from the subcommittee? And seeing none, again, congratulations, Madam Secretary. Look forward to working with you. And that ends the budget hearing on the Department of Juvenile Services. We will then, thank you very much. We will now bring up we will now have the Office of the State Prosecutor. We will begin with our budget analyst, Mr. Scott Benson, followed by our State Prosecutor, Mr. Charlton T. Howard III. Is our State Prosecutor here? Just wanted to confirm. Yes, wonderful, good. Thank you, sir. Mr. Benson, whenever you're ready.
Good afternoon, Mr. Chair. My name is Scott Benson, and today I'll be presenting the operating analysis for the Office of the State Prosecutor, or OSP. As you can see in the operating budget summary on page 1, the fiscal 2027 budget decreases by $51,000, or 1%, to $5.1 million. There are two proposed deficiencies within the fiscal 2027 budget that provide a total of $158,457 in general funds. The first is a personnel deficiency to cover shortfalls related to lower than expected vacancy savings, and the second is to address the increase in annual rent for OSP's office. As you can see in Exhibit 1 on page 3, the largest category of spending supports salaries and fringe benefits for 18 regular positions, comprising 63% of the total allowance. The second largest category is for 13.5 contractual full-time equivalent positions, of which 0.5 positions are supported with general funds, while the remaining positions are supported with a grant from the Governor's Office of Crime Prevention and Policy to support a collaborative effort with the U.S. Attorney for the District Court of Maryland. As you can see in Exhibit 2 on page 4, the largest increase is $104,860 for employee and retiree health insurance. Outside of personnel-related costs, the only increase in the fiscal 2027 allowance are due to cost allocations, which increased by $58,172, and rent for OSP's office in Towson, which increases by $5,555. The overall decrease in the fiscal 2027 allowance is largely due to contractual personnel decreasing by $261,689. Now, as you can see in the personnel data on page 5, there were no vacancies as of December 31st, 2025. Additionally, the 13 contractual positions funded through the Governor's Office of Crime Prevention and Policy include 8 assistant state prosecutors, 3 paralegals, 1 program manager, and 1 data intelligence officer. OSP reported receiving enough additional funding to support an additional assistant state prosecutor position, but this is not yet reflected in the fiscal 2027 allowance. OSP should discuss the timeline for when the funding and the contractual position will be reflected in the budget. As you can see in Exhibit 3 on page 6, the Official Misconduct and Special Victims Unit received 77 complaints in fiscal 2025 compared to 58 in fiscal 2024. This unit was created in fiscal 2024 with the goal of focusing on cases involving official misconduct and special victims. The unit's goal is not only to prosecute cases, but to increase awareness of these case types. In fiscal 2025, 11 victims and witnesses were contacted as part of OSP's investigatory process after receiving complaints, compared to 8 in the prior year. No cases led to charges being filed in fiscal 2025, compared to 3 cases in fiscal 2024. OSP should discuss the reasons there were no charges filed in fiscal 2025, and if these factors are expected to continue impacting the number of charges filed in future fiscal years. Now, as shown in Exhibit 4 on page 7, OSP received 1,712 criminal conduct complaints in fiscal 2025, excluding election law-related measures. Overall, this is an increase of 690, or 67.5%, compared to fiscal 2024. Additionally, the number of open investigations increased to 222 in fiscal 2025 from 138 in fiscal 2024. And cases closed increased significantly to 1,374 in fiscal 2025 from 570 in fiscal 2024. OSP has cited the reason for the increase in complaints since fiscal 2020 being due to high-profile prosecutions, raising the demand for OSP services. Other agencies often send complaints for OSP to consult on, even if OSP does not ultimately handle the investigation. These high-profile prosecutions have also led to agencies sending more complaints for OSP's review. OSP should discuss the expected outlook for complaints in fiscal 2026 and 2027, as well as the expected case processing times in fiscal 2026 and 2027, and efforts to prevent a backlog in open cases. Turning to Exhibit 5 on page 8, you can see the number of election law referrals in fiscal 2025 increased by 268 to a total of 979. Since fiscal 2021, the total election law referrals OSP has received has increased by 93% by 473. The reason for the increase in referrals is due to the State Board of Elections gaining access to more resources and being able to audit campaign finance reports to identify fraud more effectively than before. Additionally, OSP has added an investigator tasked to election law cases, which has enhanced OSP's ability to take enforcement actions. Civil penalties also increased by $46,442, or 16.5%, in fiscal 2025 compared with the prior year due to the increase in enforcement actions. Now, as you can see on page 9, the Department of Legislative Services recommends concurring with the governor's allowance. And this concludes my presentation. I can now take your questions.
All right, thank you, Mr. Benson. Any questions for our DLS analysts? Seeing none, I'd like to welcome at this time Mr. Charlton T. Howard III, the state prosecutor for the state of Maryland, and his team. Welcome, sir. You can begin when you're ready. And if you could just indicate for me, because we have the witness sign-up list, but just indicate for me who on your team is here so that I can make sure we have that
Absolutely.
covered.
Absolutely. Thank you, Mr. Chairman, Mr. Vice Chair, members of the Public Safety and Administration Subcommittee. My name is Charlton Howard, and I'm the Maryland State Prosecutor. I appreciate the opportunity to talk to you today about the important work of our office. I'm joined here today by our Deputy State Prosecutor, Ms. Sarah David. I'm sure many of you know, our Director of Administration, Ms. Ruth Sweeney, and our Senior Assistant State Prosecutor for Election Integrity, Brittany Dunklow, who heads up our election law efforts. We'd like to thank our tireless analyst, Scott Benson, for his work, not only on this report, but for his engagement with our agency throughout the year. Thanks, Scott. Our office has continued to take on important corruption and election law cases throughout the state. Of note, we only have 6 full-time prosecutors, including myself, to handle cases throughout Maryland. As an example, this year we successfully prosecuted an embezzlement and identity fraud scheme in Frederick County, a legislative aide that stole scholarship funds from a senator's office in Anne Arundel County, a Maryland Department of Health police captain who committed time fraud in Baltimore County, a sheriff's deputy who used restricted government computer access to find information about romantic partners in Cecil County, and a Cumberland police officer for inappropriate sexual behavior towards subordinates in Allegheny County, to name just a few. so our enforcement efforts stretch across the breadth and width of the state. Our office, as you're well aware, has jurisdiction over specific crimes related to political corruption, official misconduct, and election law. 2 years ago, as Scott mentioned, due to increased number of complaints alleging sexual assaults and sexual exploitation involving people in positions of power, we established a special victims unit in our office. As we explained when this unit was started, a majority of these cases will not necessarily be resolved in a courtroom, but they will involve working with victims to find a just outcome and to make sure that services are provided. Often victims targeted by people in positions of trust are specifically individuals who will struggle with the emotional toll of a trial process and who are afraid of retaliation in their communities. Our office cannot comment on uncharged cases, but I can say that we have worked hard with victims, law enforcement agencies, inspectors generals, and others around the state to help address these cases and, where appropriate, prosecute. We also note that these cases take a long time to investigate given the need for forensic evidence from computers, cell phones, and other devices. We have charged and successfully prosecuted several important special victims cases in the past year, both prior to and after the term that Scott mentioned that we didn't have any. And we are proud of our continued success in this area under the leadership of our SVU unit head, Senior Assistant State Prosecutor Mary Setzer. As our office continues to engage with our partners and take on complicated, high-profile cases, we have seen, as you've heard, our complaints rise in both general corruption and election law cases. We have combined them in our reporting statistics to best portray the total workload of our office and the breadth of our efforts across the board. Many of our election law complaints are handled through engagement with the individuals named and fostering compliance, ensuring the campaigns across the state are correctly filing their reports on time and accurately. We're also proactive in the election law space, working with our partners at the State Board of Election and law enforcement, as well as this legislature, to address anticipated challenges in artificial intelligence and its potential use in our elections. We're working hard to ensure that we are handling our evolving challenges with our limited staff through leveraging partnerships, but aware that as our complaints continue to rise, we need to make sure we can address our cases at the highest professional level. Though our resources are adequate now, they may not be so in the future if our complaints continue to show this upward trend. While resources are limited, we strive to achieve our important work. Very proud of how our agents and attorneys work to ensure we're taking on significant and challenging cases throughout the state. As I've often mentioned, I believe we have the best law firm within the state of Maryland, government or private, even though small in number. We also know we have taken on managing the Special Assistant United States Attorney, or SASA program, through the GOCAP. And there seems to be, just to allay any confusion about this, these are contract positions that we manage administratively, but they're detailed to the U.S. Attorney's Office to work on exclusively violent crime investigations and prosecutions in both the Greenbelt and Baltimore office. And as recently noted by U.S. Attorney Kelly Hayes and others, that our office, that those special assistant U.S. attorneys have been critical in the overall reductions in violent crime that these areas have experienced in recent history. This program is a separate initiative to help offset violent crime, and whereas we're happy to support this important program, we have to be careful not to distinguish it from our core mission of fighting political corruption and official misconduct, which is why this office was founded. We appreciate the governor's allowance in our budget and concur with that allowance. Thank you so much for your attention and your support of our office. We provide written testimony to address in depth the questions identified about our structure and future goals, but I'd certainly welcome, and my team would welcome, any questions at this time.
All right, thank you, Mr. State Prosecutor. Appreciate that. And we do have the benefit of your written reply. Any questions of the subcommittee? Delegate Kaiser.
Thank you, Mr. Chairman. And thank you all for coming in today. I had a question in regards to the personnel data. There was a prompting question from our analyst about discussing the timeline for the funding and the contractual positions being in the budget, but my question is actually a little bit different. Seeing how many regular positions you have and how many contractual you've had, I'm wondering, long-term, are you transitioning? Is the goal to transition them to regular employment? Is there a reason not to in some seasonal change in some of these, or some specialty areas that require that outside counsel?
Well, thank you for your question, Delegate Kaiser. And I think it gets confusing as you look on the borderline between, particularly because we're managing two different kinds of contractual employees.
Okay.
We have 0.5 of an FTE, a contractual pin, in our office that works on our core corruption efforts. That is a very senior lawyer who retired after a successful career in the U.S. Attorney's Office. Ms. Joyce McDonald, she's recognized as one of the best corruption prosecutors in the state, and we are fortunate to have her advice and insights, even just on a part-time basis, to work with us in counseling those cases. She's very happy in that contractual position. If she leaves, she's sort of a unique individual. I don't anticipate having to roll that into a permanent position at that time. We certainly wouldn't turn penny pins down. We can certainly make use of them, but that's not necessary, I believe. Then we talk about the contractual positions provided through the governor's office, the GOCAP. Those are specifically grant funded, and I don't think it would be advantageous, though I can't speak for the governor's office in this particular realm, but from my perspective, to move that into a permanent part of our budget, because there's things with grant funding that are unique to grant funding, particularly demanding performance, looking at issues. If the mission was changed by our partners in any particular area, we want to be able to maintain control over those positions, and that control is best established through paying for them and continuing that grant funding. Sarah, do you have any comments on that?
Well, I think, if I could step in, I think I then misunderstood as I look back at the part coming from the governor's office and through the grant funding. So I wanted to cut you off because I think I now understand that I didn't ask the best question, but I have a second question that might be better that's completely different. I'm looking at the election law referrals. There's I guess there was a huge amount in 2023, but a massive increase, a big increase from 24 to 25 in referrals, enforcement actions taken maybe more modest. Why do you think we're seeing so many of these referrals? Are they errors that don't rise to the level of your office, or are they misreferrals, people who maybe shouldn't be making those referrals?
Well, our election law, let me take it, that's a great question. Let me make an attempt to answer it, but I'm fortunate to have our duty experts in our election law here with Ms. Dunglow, Ms. David. So, but generally all of our referrals come, the vast majority come from the State Board of Elections. Doesn't mean we don't get some anonymous complaints and things of that nature, but I would say the majority of them come from the State Board of Election. And our referrals are tied to the election cycle. So some years we get far more referrals than others. And it was counterintuitive. I always thought if it's an election year, those would be the most referrals. But actually, year after, the year before, when you start having reporting requirements come into play, as you all are very painfully aware of the reporting requirements leveraged by the State Board of Elections, for those that don't comply with those requirements, we get those referrals during those periods of times. Others are more that don't come. They come from the State Board of Elections, but they're not tied to the election per se. Those are come in more of a steady stream. But that accounts for the somewhat wide variance from year to year. I would be very concerned if it went from 900 to 0 or to 100, but I think in these numbers we're comfortable. Sarah or Brittany, do you have anything to add to that?
Yeah, I'll just note, if you recall sort of from your own experiences, there are 6 reports due the year of the election. So the goal is compliance. So the State Board of Elections gives opportunities for people to become compliant before they refer them to us. So so we're going to see an uptick the year after sort of we have had 6 reports, right? And we're going to have, that each one of those reports results in a compliance conversation with the committees, and then it sort of gets referred. And so because that streamline effect, I think when you're thinking of referrals, maybe it's more of the authority line or some of these other issues. Those happen, but sort of the larger number is related to the filing. I'll also note that as the State Board of Elections has increased their auditing capabilities, that also triggers more referrals for our agencies, because they're able to detect anomalies beyond sort of what are typographical, right? Those, again, the goal is compliance. But we have, had a few larger prosecutions where those anomalies have actually led to, understanding that money is being misused or stolen or other types of things. And so that sort of is where the corruption election law bridge exists. So their auditing capacity and the increase of reports does sort of serve to meet that heightened number.
Brittany, did you want to add anything?
No, that was it.
I would just like to add one last thing. I think I'd like to highlight the value of our partnership with the State Board of Elections. It's as good as I've ever seen it, and it's always been pretty good. And that ability to leverage each other's advances in technology and better investigative tools, better auditing tools, better information flow, helps us to get much closer to our compliance goals. Again, our goal is not to have 100 prosecutions or 100, we have 100 compliant campaigns that are working well and providing the transparency that you need to ensure the integrity of the election process.
All right. Thank you, Delegate Kaiser. Thank you, Mr. State Prosecutor. I don't see any further questions from the subcommittee for you and your team, so appreciate it. Thank you very much. I do have one witness that's signed up to testify. Is there a Miguel de Leon here? No. And we don't have any virtual witness, correct? All right, seeing none, that ends the budget hearing on the Office of the State Prosecutor. We will move next to the Subsequent Injury Fund. We will begin with our budget analyst, Mr. Michael Richards, followed by Edgar D. Todd III, the Director of the Subsequent Injury Fund. Mr. Richards, good to see you again.
I will be presenting the Subsequent Injury Fund, referred to as SIF, Fiscal 27 Budget Analysis. Starting on page 1, SIF Fiscal 27 budget increases by $2,529 to $3.6 million compared to Fiscal 26 appropriation. On page 2, Exhibit 1, 82% of the fiscal 27 allowance supports personnel. On page 3, Exhibit 2, personnel expenses decreased by around $27,000 in fiscal 27 compared to fiscal 26. On page 5, Exhibit 3, the assessments collected increased by 3.4% in fiscal 25 compared to fiscal 24, and SIF's fund balance continues to increase. On page 6, Exhibit 4 of the closing fund balance for fiscal 25 was $140.5 million. On page 7, Exhibit 5, the average cost per claim in fiscal 25 increased by 23% compared to fiscal 24. On page 8, DLS requests for SIF to concur with governor's allowance. On page 9, in the most recent audit report, SIF had 0 findings. This concludes my presentation, and I am available for any questions.
Right. Thank you, Mr. Richards. I'd like to welcome now Edgar G. Dodd III, the Director of the Subsequent Injury Fund, and any member of your team, sir. You can feel free to welcome up, and you can begin when you're ready.
Thank you, Mr. Chair. I'm pleased to be joined this morning. First of all, my name is Edgar Dodd. I'm the Director of the Maryland Subsequent Injury Fund. I'm pleased to be joined today by 2 key members of our team. On my immediate right is Ms. Rose Hunt, our Fiscal Services Administrator, and to her right is Mr. Ken Riat. Mr. Riat is an accountant in our fiscal unit. So I would like to thank Mr. Micah Richardson for his astute analysis. Thank you, Micah, for your work throughout the year and your consultation with us. You're always very professional and very helpful to us. And I'd like also to recognize Ms. Sandy Henderson, who is our DBM budget analyst. Sandy is always available for any questions that we have throughout the year. And we're very lucky to have these 2 professionals working with us. I submitted written testimony to you all, and I certainly don't want to go through all of that. I will just add one thing, that we just recently had a brand-new actuary study that was completed, and the actuary acknowledged an average 7.1% annual SIF balance growth over the past 10 years. And the actuary agrees with the recommended continuation of our current 6.5% assessment rate through at least 2030. And that is the next scheduled actuary study on our calendar. The one thing I would like to revisit on Mr. Richards' analysis is our most recent actuary study. It bears repeating. We had an unprecedented 0 findings in that study. And in this day and age, I think that's something to crow about. And it's a credit to these two professionals sitting beside me and the other men and women at the Maryland Subsequent Injury Fund that work tirelessly in service to injured Maryland workers. And with that, I'll take any questions that the committee may have.
All right, thank you, Mr. Dodd, and thank you to your team for being here, and appreciate all the work that you all do on behalf of those folks who are injured and certainly need relief. It is certainly appreciated. So with that, I'll open it up to any questions from the subcommittee, and I don't see any. So Mr. Dodd, that means you and your team did a phenomenal job, and it is certainly appreciated. So that ends, well, yes, there are no witnesses, but that ends the hearing on the Subsequent Injury Fund. Next, we will have the Uninsured Employers Fund, our DLS analyst, also Mr. Micah Richards, and then we'll have Andrew M. Anderson, the acting executive director, who I believe is here. Or no? He's okay. All right, Mr. Richards.
I am presenting the Uninsured Employers Fund, referred to as UEF, Fiscal 27 Budget Analysis. Starting on page 1, the Fiscal 27 budget increases by 1.5% to $6.1 million compared to Fiscal 26 appropriation. On page 2, Exhibit 1, 57% of the Fiscal 27 allowance supports the third-party administrator, referred to as TPA. The TPA is Corvell, and UEF contracts with a TPA for the TPA to manage UEF's claims functions. On page 4 and 5, Exhibit 3, in Fiscal 25, the cost per claim decreased by 27.4% compared to Fiscal 24 due to a significant increase in the number of resolved cases. On pages 5 and 6, the amount of benefit payments in Fiscal 25 decreased by 10.2% due to the TPA increasing the share of claims in which another party is responsible for payment. On pages 6 through 9, Exhibit 5 in Fiscal 24, the expenditure exceeded the revenue by $1.8 million. In Fiscal 25, the revenue exceeded the expenditure by around $160,000 due to a lapse in the contract between UEF and the TPA from July to October 2024, resulting in UEF not having to make payments to the TPA for the 4-month period. The TPA current contract is from October 2024 through October 2029. According to the Department of Budget and Management, the estimated expenditure by the close of Fiscal 26 is expected to exceed revenues by $1.8 million. Exhibit 6 shows the costs of the TPA are the main cause of the expenditure exceeding the revenue. During the 2025 session, DLS projected that UEF would become insolvent by the close of Fiscal 27. However, DLS now projects that UEF will remain solvent through Fiscal 27 due to the revenue exceeding the expenditure in Fiscal 25. Exhibit 7 shows the estimated Fiscal 27 fund balance will close at $1.7 million. Due to the current financial situation, it is projected that UEF will become insolvent sometime during Fiscal 28 unless UEF receives additional revenue or has lower expenditures to ensure UEF's solvency after Fiscal 27. On page 10, DLS recommends to restrict $100,000 of UEF funds in fiscal 27 until UEF submits a report documenting whether a third-party administrator is needed for the entire 5-year contract in their staffing capacity to manage claim functions in-house due to the report not being submitted, it wasn't submitted per the request from the 2025 Joint Chairman's report. Page 13 details that in the most recent audit report, UEF has 3 findings. This concludes my presentation, and I'm available for any questions.
All right. Thank you, Mr. Richards. Any questions for our budget analysts? Seeing none, at this time I'll welcome Andrew Anderson, the acting executive director of the Uninsured Employers Fund, who I understand is virtual, as well as I have a Saran Taylor, a David Steisch. Are those folks here? You can feel free to come up.
Yeah, I think I'm going to go with this David Steisch.
Yes, David Steisch.
I'm the principal counsel with the Office of the Attorney General. I'm not authorized to testify as a witness to the question.
Gotcha. So this is a mistake, is what you're saying. Gotcha. Okay. And I have a Saran Taylor. That's a wonderful. All right. And are we able to get Mr. Anderson on virtually? Yeah, sure.
Thank you, Mr. Chair. And to ask a question, sorry a little bit late on the question. I was looking at pages 6 and 7, and I wasn't able to, I guess page 8 too, about UEF's financial future is challenging. My understanding is both the money coming in and the money going out really has nothing to do with anything related to their administration. This is more a policy questions for us. I feel like other times when we're looking at budget information, there's something that the agency has some control over. So what is the status of the UEF, the financial, the part about the fund balance?
So in the years with the TPA contract, they're using a TPA to manage claim functions for the agency. And so the amount of money that they were paying the TPA, because the previous contract from June 2019 to June 2024, they paid $11.5 million. And so the expenditures have been exceeding their revenues due to mainly caused from the cost of the TPA. Now, the current contract, they're expected to pay in the 5-year period $8.4 million, but because the revenues are lower than the expenditures, over time, their fund balance is decreasing. So last year, it was the House and Senate did pass legislation to increase their assessment from 2% to 2.5% to increase their revenue. And then we also, it was requested for them to have an overseer to evaluate their capacitive functions in their office to see how they can decrease some of their expenditures by doing some of the functions in-house instead of having a contractor fulfill those functions. So both those, the legislation was vetoed. So right now, they are still in the same situation. I mean, we projected last year was fiscal 27, but due to due to the negotiation of the new contract, they did not pay the TPA for 4 months, which means their revenue exceeded the expenditures at the close of fiscal 25, but it was only by around $160,000. So right now, it is expected that their revenue, their expenditures will exceed the revenue at the close of fiscal 26 and at the close of fiscal 27, which is decreasing their fund balance. And so based on the estimated revenues and expenditures, we are projecting that their fund balance at the close of fiscal 27 is $1.7 million, which, based on their financial situation, it's projected that that will not be enough to keep the agency solvent by the close of fiscal 28, unless their revenues increase or their expenditures decrease. So that would be a policy situation for the legislators. Just like last year, it was you proposed and voted on legislation to increase their revenue. So yes, that, but for the agency right now, we need to know what is their capacity to do some of the claim functions, because they are paying the injured workers based on the verdict from the judges from the WCC. So by law, the state is required to pay the injured workers this amount of money, which are the claim payments. And so for the agency, the concern is, can they do some of these functions that the contractor is doing in-house? And then as far as increasing their revenue, that would be a situation for legislators.
Appreciate that. Thank you. Ms. Taylor, what is your role at UEF, so I understand?
Fiscal Account Technician 2. I've been there since 2018 through another agency, and started with the state in 22.
Got it. Okay, thank you. And so I see the camera is on right now, but it is muted for Mr. Andrew Anderson. I don't know if he can hear us, or if someone who works with him can text him to let him know that he is due to present on behalf of this agency.
I'm not sure if he's in that office, because that's our office, but I think he was working from home today. So I'm not quite sure how that's set up. I do have his written statement. If you want me to go ahead and
if you can, and I think we'll give him some time, hopefully by then. The hope is that at some point during the hearing that he's able to hop on in the event that members do have questions. I mean, he is the agency head, but we will, given the situation, the time, allowing Ms. Taylor to present on behalf of the agency. And if we have any questions, we'll be sure to ask you. So if you'd like to begin, you're welcome.
Thank you. Again, my name is Saran Taylor. In the first area of operational concern is the cost of the UEF's third-party administrator. In 2014, the director recognized issues with the claim functions and hired a private contractor to assist. Throughout 2014, additional individuals were added to assist the contractor. In August 2015, due to the untimely death of the director, Mr. Anderson was appointed acting director from September 2015 until November 2016. Also in 2016, due to the claims contractor's inability to perform satisfactorily, their services were subsequently terminated in 2017. During this period, the agency's goals shifted to bring the claims function in-house. A committee was set up, positions advertised, about 150 resumes received, and approximately 20 applicants were interviewed. The committee was comprised of in-house workers' compensation attorneys, staff, and himself. Applicants' backgrounds were varied, but none possessed relevant experience in the workers' compensation field, and no offers were extended. Subsequently, based on the WCC's recommendations to hire a third-party administrator, and while considering new employee costs, trainings, computer system requirements, the agency decided to solicit bids from established TPAs. The Board of Public Works approved an emergency procurement contract in or about 2017, which ultimately resulted in the current contract with our TPA. The second area of operation concerns is the UEF's assessment rate of 2%, which has been stagnant since about 2009. In 2016, a letter was sent to the legislature through DLS requesting an assessment rate increase to 4%. DLS agreed with the request. However, a response to increase was never received. The UEF is a 100% self-funded agency, and the current 2% assessment rate is inadequate. The agency does not have the funds to continue paying claims without an increase to about 4% or 4.5%. And to add, I know you had mentioned the increase about the 2.5, 2 to 2.5%, that was vetoed by the governor.
All right, does that conclude your statement?
What I have, yes.
Thank you very much, Ms. Taylor. It is certainly appreciated. Any questions for the fiscal officer over at the UEF? All right, seeing none, I want to thank you first for being here in person and your willingness to testify and to answer any questions from this subcommittee. I'm a little bit disappointed that Mr. Anderson could not join today. This is his agency. He is the executive director and therefore responsible. And the expectation is that he would be here in person. My understanding from staff is that he had insisted on being virtual. And so the fact that you insisted on being virtual and then not showing up to this subcommittee hearing is not just disappointing, but is something that we're going to certainly take note of. We will follow up with Mr. Anderson because going forward, as much as we appreciate you, Ms. Taylor, and others from the agency who are here to answer questions, it is fundamentally the responsibility of the executive director acting in this case to be here or to make himself available to answer questions from us. So we appreciate you, and I'll just echo again my disappointment with the executive director for not being on, and we will certainly follow up. That should be it. Thank you very much. I do have a Michael, is there a Michael Schaffer here from Corville Corporation to testify? Did you mean to testify? Do you plan on providing remarks?
It's my understanding I was signed in as a witness in case any questions.
In case any questions.
Pertaining to the TPA portion.
Gotcha. Okay, good. So you're not testifying. All right, I'll make a note of that. Another person who is here to answer questions, but the executive director cannot. All right, that ends the budget hearing for UEF and the budget hearing for PSA. Thank you.